Refugees are a little different than immigrants. Refugees are given that designation by the UN. And they're given that designation that this group, this population, is a refugee because, sadly, most of them have had to flee their home country, usually because of conflict, because of war, and have had to leave very suddenly. And most of them have experienced incredible trauma. They witnessed violence, and they then move to a second country. And it's in that country where they're often in refugee camps. Very small percentage of them get resettled. It's less than 1%. And the United States agrees to take some of them. You can imagine these families rarely speak English. They've been through horrific trauma. They have all sorts of health burdens. They have all sorts of health problems that most of them have not had addressed in their country of origin or where they've been staying, their asylum country. And we found with a couple of things that we could really make a difference as far as their being able to get the health care they need by making what we would call medical home. You can imagine these families have left their home. They've left everything that they know. They're in a totally different place. We have families who have witnessed family members being killed. Poignant stories of one woman from Iraq who tells us about what it's like being under rubble, knowing that your family members are under rubble and they're dead next to you. Incredible trauma. And the kids have witnessed this. So mental health, developmental. For a lot of these children, if you're a 2-year-old, but the first 1.5 to 2 years of your life you've been on the run and have been swaddled, you may not know how to walk. Your skills are very different. So for a lot of the children, their school has been totally disruptive, so there's educational needs. Most of them have never been to a dentist, so there's a lot of oral health needs. One of my sweetest moments for me was not too long ago with a mother that I know pretty well from Burundi who speaks Kirundi. She's been here for several years now. And I was asking her some questions and said, well, if this continues, come back and see me if you need to. And she said, of course, we know. You're the mother of the Burundians. So, of course, I was, I still almost get choked up thinking about it because it's all about relationship. It's also about relationship with providers, So often those of us who take care of people, we have our own little silo and our own little way of dealing with a particular problem, but there are other people who have their own perspective, and that with lifespan allowing us to collaborate so that we can collaborate with outside organizations like the Department of Health and the International Institute and Family Services. It really makes a huge difference as to how we can better care for these families.